when you get to this part of the story, part I'm in now, you you stop being angry about the past and the future, and the future doesn't have you in its plans, so that just leaves now. That's all we have is now. Mm. It's not enough, but it's all we have. It's just a little more now.
Good afternoon. My name is Chabadegi, and I would like to take this opportunity to thank you so very much, Nevanka, for your kind invitation, and of course to say hello to everyone in Maribor at the EFIC School and Conference. I will have a long presentation, but I hope you are going to enjoy it. We'll start with the mind's battle and a very short introduction on exploring the psychosocial aspects of cancer. As I'm very sure you're all aware of, cancer is a very complex disease, but it is certain that it not only affects the physical body, but also has significant psychosocial impact on patients and their families. And most certainly, the diagnosis of a cancer can cause emotional distress, anxiety, depression, and fear of death among patients, of course, leading to important changes in their quality of life. The psychological impact actually can be severe and long lasting in cancer. Patients may experience a range of emotions such as shock, denial, anger, guilt, and sadness. And certainly, these emotions are affecting their ability to cope with the disease and to make decisions about cancer treatment. And many times, these emotions are leading to feelings of helplessness and hopelessness. Of course, cancer can also have a significant social impact on patients and their families. Patients may experience social isolation, stigma, and discrimination due to their illness. And many times, as we are going to talk about it later on, they face financial difficulties, financial discrimination, loss of employment, and very much so disruptions in their daily routines, leading to further stress and anxiety. In all this situation, coping strategies are playing a crucial role in helping patients to manage the psychosocial burden of cancer. Patients can benefit from various coping strategies such as cognitive behavioral therapy, mindfulness based interventions, and support groups. These are all enhancing coping strategies in patients, but we will talk about this in a separate chapter later on. Of course, all of these strategies can help patients develop resilience, improve their emotional well being, and enhance their quality of life. As my very dear friend Leah Bider from Israel is saying, cancer is a family business indeed, because it not only affects the patient but also has significant impact on their families. Family members as well may experience emotional distress, anxiety symptoms, and depression due to the cancer of their loved ones. Also, they may face burden in providing care and support to the patient, leading to so-called caregivership stress and caregiver burden. So, from the start, I think we should really understand that it is crucial to provide comprehensive care that addresses all these needs, the physical, the psychological, and the social needs of patients and their families in order to improve their quality of life and overall well being. And I might add also the survivorship planning. Yes, breaking the silence is such an important part at the beginning and all along the cancer journey. And it comes down, first of all, to speaking up about the cancer distress. Cancer distress is a very complex emotional response that can manifest in various ways, like on a spectrum including anxiety, depression, anger, and fear. Cancer related distress also can arise from very different factors, including the physical symptoms of cancer, the uncertainty of the future, and the impact of cancer on the daily life. Other variables that can contribute to the cancer distress include the financial strains, social isolation, and sometimes the side effects of the cancer treatment itself. As I just noted, the symptoms of cancer related distress can vary from person to person, but certainly it may include feelings of sadness, hopelessness, and worthlessness. Also, here other common symptoms of cancer related distress are difficulty sleeping, loss of appetite, and a lack of interest in activities that patients once enjoyed. Cancer distress has to be assessed and managed. There is no way around that, right? And there are various strategies for managing cancer related distress, including the talk therapy, sometimes, if needed, medication, self care practices as well, such as exercise and meditation. But we're going to come back to the evidence based interventions a little bit later on. But I think the most important thing is for the patients to feel supported, to have a strong support system for them in place, including family members, friends, healthcare professionals, who, of course, can offer practical support but also emotional support at the same time. Here, in cancer distress management, healthcare professionals play a crucial role because they are the ones who are identifying and addressing cancer related distress in patients. And they are doing this by offering screening for distress. And also, together with the screening, we have to offer appropriate interventions in order to manage the emotional response of the cancer patients and to improve their quality of life. So we must be very clear that cancer distress, it's a common emotional response to cancer diagnosis that affects almost half of our patients, and it can have a significant impact on patients' quality of life. Now we are getting closer and closer to meeting the psychosocial needs of cancer patients. So we are moving beyond the cancer diagnosis. And as I have just mentioned many times in the beginning, patients indeed are experiencing feelings of anxiety, depression, fear, and uncertainty. And having strong emotional support can help them cope and improve their quality of life. And of course, helps them to navigate the physical and also the emotional challenges of cancer. So, I think that we would like to be in a position to help patients having a variety of coping mechanisms because like this they can manage their emotions and their sense of control during such a difficult time like the cancer journey and the uncertainty of the cancer journey. Of course, there are many coping strategies that we are going to talk about, but this can include um, common ones like relaxation techniques, mindfulness practices, exercise, or other creative involvement. Also, part of the coping, it's effective communication between all people affected by cancer, between the patient, their loved ones, and the healthcare providers. It's very essential, this kind of communication, for management, addressing and management of psychosocial needs, because patients with cancer should feel comfortable expressing their emotions and concerns, and healthcare providers should be ready to listen actively and to provide clear information and support. So, open and honest communication can help patients make informed decisions about their treatment, and this is helping through their sense of control and a sense of meaning. It's helping to improve their overall well being and quality of life. Communication and information are working together, because access to accurate and reliable information is crucial for patients to make informed decisions, and very important from the psychosocial perspective to feel empowered in their cancer care. So, clear and understandable information about the disease, treatment options, side effects, and resources available might benefit the patient from a psychological and social perspective, because information can be provided through support groups, online resources, educational materials, leaflets, and it's going to help in understanding and managing the cancer journey. So, here the learning point is that psychosocial needs are an integral part of the cancer care that should be addressed alongside physical care by providing comprehensive cancer care. In this battle with cancer and cancer distress, we should turn to psycho-oncology and the instruments of psycho-oncology. Psycho-oncology is a field of study that focuses on the psychological and social aspects of cancer, and it addresses the emotional, social, and behavioral issues, needs that are related to cancer and the cancer treatment. These instruments, assessment tools of cancer distress, for example, are essential components of psycho-oncology because they help clinicians and researchers identify and measure psychological distress, quality of life, coping strategies, and all other relevant psychological factors. One of these, and it's widely used, is the distress thermometer. It's a widely used screening tool that assesses the level of distress experienced by cancer patients, and it consists of a thermometer like scale ranging from 0 to 10, where 0 represents no distress and 10 represents extreme distress. So, this kind of thermometer can also be used by healthcare professionals and can be also self administered by patients. Another very important assessing instrument is the HATS, the Hospital Anxiety and Depression Scale, which is a self-report questionnaire that assesses the symptoms of anxiety and depression in medical settings. It has 14 items, 7 for anxiety and 7 for depression, and it is a validated and useful tool for identifying patients who may need further assessment and treatment for their anxiety and depressive symptoms. The FACT system of assessment, the functional assessment of cancer therapy, is a series of questionnaires that are assessing various aspects of quality of life in cancer patients. It has a lot of subscales, including the physical well-being, the social family well-being, emotional well-being, and functional well-being. The fact has been widely used in clinical trials and research studies, and it is a comprehensive tool that provides valuable information about patients' overall well-being and functioning quality of life. CBI, Cancer Behavior Inventory, it's a self-report questionnaire as well that assesses coping strategies and behaviors in cancer patients. It has 33 items that are measuring coping domains like cognitive avoidance, emotional expression, positive attitude, and seeking social support. The CBI has been also used in many research studies to examine the relationship between coping strategies and psychological outcomes in cancer patients. It can give us insights into how patients are coping with cancer related stressors, and it can help us to personalize interventions to improve coping skills as well. So, assessment tools are crucial for the effective management of psychological and social issues in cancer patients. Breaking the stigma comes first because, as you will see, this is one of the most important barriers for psychotherapies and for mental health care in cancer patients. So, as we discussed, anxiety is one of the most common mental health issues experienced by cancer patients. The fear of unknown, uncertainty about life, about future, about destiny, and concerns about treatment can all impact and can all facilitate anxiety. Together with anxiety, depression is also another common um, symptom that cancer patients are facing. The stress and emotional burden of cancer can also lead to feelings of sadness, hopelessness, and loss of interest in the activities that patients usually were happy to perform each day. On the same spectrum, other mental health issues can also be experienced by cancer patients, like the post traumatic stress disorder, PTSD, quite frequently insomnia and body image issues. They all are impacting coping and quality of life. We're going to talk much deeper about psychotherapies and support for mental health support for cancer patients later on. But we here must again address that the most common forms of therapy, like cognitive behavioral therapy, CBT, are very well used to treat anxiety and depression in cancer patients. Because, as we all know, CBT is helping us to identify the negative thought patterns and replace them with more positive ones. And they can also teach coping skills and relaxation techniques that are maybe very important also in the sleeping disorders. Mindfulness based stress reduction, MBSR, is another psychotherapy that can be useful for cancer patients, including the mindfulness meditation, body awareness, and also yoga to help patients to reduce distress and to improve their overall well being. We mentioned earlier the impact of support from groups like family therapy and art therapy groups. So this can be also on our list of psychotherapies for cancer patients. But even though there are so many well provided interventions or well proven interventions, there are many barriers that prevent cancer patients from accessing psychotherapy. And of course, one of them is the cost of the treatment. Many patients may not have insurance or may not afford co-payment of the psychotherapy services. Also, in many countries around Europe, around the world. There is a shortage of mental health professionals in the area of psycho-oncology, making it very difficult for patients to find a therapist who is specialized in cancer care. Also, the C stigma, stigma surrounding mental health issues, is still another barrier that are preventing some cancer patients from seeking out help. Patients may feel ashamed or embarrassed about their mental health struggles and worry that they are going to be judged by others if they are asking for mental health for help for mental health issues. So I am very sure that it's critical to address these barriers. This comes first because if we want to ensure that all cancer patients who are in need of support and therapy have access to mental health care that they need, then we have to uh, work on these barriers. So this is essential. Yeah. Now we will have a short summary of the evidence-based interventions in psycho-oncology. We will start with cognitive behavioral therapy as one of the first options of interventions in cancer care. CBT is a type of therapy that focuses on changing negative thought patterns and behaviors. Research has shown that CBT can be very effective in reducing anxiety and depression in cancer patients. Mindfulness based stress reduction, or MBSR, is a type of intervention that focuses on the present moment without judgment. And studies have found that MBSR can help reduce symptoms of anxiety, depression, and fatigue in cancer patients. Supportive expressive therapy, or SET. SET is a form of talk therapy that help cancer patients express their emotions and cope with the stress of cancer. Research data has shown that this type of therapy can improve quality of life and reduce also the symptoms of depression and anxiety. Art therapy must be mentioned as well because it helps patients express their emotions and cope with the stress of cancer through using art materials and instruments. Research has shown that art therapy can improve mood, reduce anxiety, and enhance quality of life in cancer patients. So, the learning point here is that evidence based interventions in psycho-oncology can be so much effective in improving the psychological well being and quality of life of cancer patients. I am very sure that surviving cancer is the ultimate goal. And so we have come here to a point when we have to dwell into the psychology of overcoming adversity with new evidences. So we're going to talk about the psychology of cancer survivorship. Cancer survivorship is part of the cancer journey, and it's a very complex and very nuanced experience that can have profound psychological effects on patients. Survivors often face a range of challenges from physical symptoms and side effects, long term side effects of treatment, to emotional and social issues as well. So, recent research presented that many factors are influencing survivors' well-being and quality of life. And now we are going to share some of them. Social support again, and the impact of social support on cancer survivorship. It's a critical factor, with studies showing that patients who receive strong support from family, friends, and healthcare providers tend to have better outcomes and higher quality of life in cancer survivorship. New research has also highlighted the importance of peer support group and online communities for cancer survivors because they are providing opportunities for connection, information sharing, and emotional support. So, healthcare providers should prioritize all kinds of efforts to facilitate social support networks for cancer survivors and their families. Also, data is showing that the role of mindfulness in cancer survivorship is pretty significant. So, mindfulness based practices such as meditation, yoga, have been shown to have significant benefits for the cancer survivors, reducing symptoms of anxiety, depression, and stress, and improving the overall quality of life. They can also, as we talked about, may improve immune functions and reduce inflammation, potentially impacting the cancer recurrence and survival rates. So they must be included in the psychology of cancer survivorship. And this is such a sensitive issue, the impact of cancer of recurrence or the fear of cancer of recurrence. It's a very common fear among survivors, with many experiencing significant anxiety and distress related to the possibility and also uncertainty of their cancer returning. So, this kind of new research is providing information and support to manage the fears of cancer recurrence and cope with the emotional challenges of living with a history of cancer. So, we have to highlight the importance of the fear of cancer recurrence in the psychology of survivorship. And once again, the benefits of exercise for cancer survivors cannot be overestimated. There are numerous benefits for cancer survivors from exercise, like improving physical functioning, reducing fatigue and other treatment related symptoms, and enhancing overall quality of life. Exercise might also have protective effects against cancer recurrence, potentially reducing the risk of cancer progression or disease progression and improving the long-term survival rates. So this data findings are underscore the importance of including exercise in the survivorship care plans because without survivorship care planning, there is no surviving. So, survivorship care planning it's really truly a critical component of cancer care nowadays because that means that we are providing patients with personalized information and resources to manage their ongoing health and wellness needs along the survivorship journey. Also, recent research highlighted the need for improved survivorship care planning, with many cancer survivors, reporting dissatisfaction with the quality and comprehensiveness of their care that they received. So, healthcare providers, we have to prioritize all efforts that are improving survivorship care planning in order to uh, receive and support the resources that cancer survivors, need, not just to live, but also to thrive, which is the idea and the main core of the psychology of survivorship. Navigating sexuality and intimacy in cancer patients actually comes down to three keywords: sexuality, intimacy, and orientation. So, for healthcare providers, it's so very important to address these issues with high sensitivity and compassion, and also to provide resources and support to help patients navigate changes in all of these highly personal parts of the cancer journey. As we discussed, cancer treatments such as chemotherapy, radiation therapy, and surgery can all have an impact on patient sexuality. For example, chemotherapy can cause sometimes fatigue and nausea, which can make it difficult for patients to engage in sexual activity. On the other side, radiation therapy can cause sometimes vaginal dryness or scarring, which can make intercourse painful. And surgery, indeed, can cause sometimes um, physical changes that are affecting sexual functioning. So it's so important for healthcare providers to discuss this sexuality related potential side effects with patients before treatment begins and to provide resources and support to help patients manage them during their cancer journey. This may include refers to sexual health specialists, counseling services, or support groups. The ability of patients for intimacy can also be impacted by treatment, but they can also be impacted by emotional changes such as anxiety and depression. Patients might also be very conscious or feel self conscious about the scars or other visible signs of their cancer or their illness, their treatment. So, healthcare providers can help patients navigate these challenges by providing resources and support to discuss and communicate about intimacy. This also includes counseling services, couples therapy, or educational materials on communication on sexual health. Orientation is also very important because every day we are getting closer and closer to having more equity and inclusiveness in cancer care. Patients may experience discrimination or stigma related to their sexual orientation or gender identity in cancer care. And many of them are still experiencing them. So, healthcare providers must provide a safe and supportive environment for all cancer patients, regardless of their sexual orientation or gender identity. This may include, you know, training staff on LGBTQ plus issues, providing resources and support for LGBTQ plus patients, and advocating for LGBTQ plus rights and equity in cancer care. Sexuality, intimacy, and orientation are important aspects of a patient's overall well being and quality of life. So, healthcare providers must address these issues with sensitivity and compassion in planning survivorship. Navigating employment challenges is also a very important part of survivorship planning. So, cancer and work issues. We also have to talk once again about the barriers like discrimination in the workplace. One of the major issues actually faced by cancer survivors in the workplace is discrimination. Some employers may be hesitant to hire a cancer survivor or a person with a cancer history or to promote someone who has had cancer due many times to misconceptions about the abilities of patients who experienced cancers or concerns over the potential health problems. Also, cancer survivors may face discrimination from co workers, not just employers, who Co-workers are or could be uncomfortable with working with someone who has had cancer. So there is a really high burden when we are talking about the difficulty of finding work. As we just mentioned, many employers may be reluctant to hire someone who has a history of cancer due to the concerns over their health or the potential time off for the treatments related to cancer. This may be especially difficult finding work for those cancer survivors who have been out of work for an extended period of time while undergoing treatment or recovering from cancer. Despite the challenges faced by cancer survivors in the workplace, in many countries there are laws in place to protect their rights, and we will discuss more elaborately about this in the next chapters. For example, the Americans with Disabilities Act, the ADA, in the United States requires employers to provide reasonable accommodations for employees with disabilities, including those who have had cancer. These accommodations may include flexible work hours, time off for medical appointments, or modified job duties to accommodate the physical changes experienced by cancer survivors. So, supporting cancer survivors is in the workplace, it's so crucial because this is something that first and most importantly has to be taken by employers. They have to take the first steps to provide access to resources such as counseling services or support groups for employees having a cancer history, offering paid time off for medical appointments or treatments, or implementing policies to prevent discrimination and promote inclusivity at the workplace. By creating a supportive and accommodating workplace, employers for certain can help cancer survivors overcome the challenges that they are facing in their careers, in their workplace. So, as a learning point here, that we must raise awareness of the employment issues faced by cancer survivors, and we must promote inclusivity in the workplace so that we can create a more supportive and equitable workplace for all, including cancer survivors who are returning to their work. Of course, all of this cannot be achieved without the power of collaboration or the multidisciplinary team approach in cancer care. MDT or multidisciplinary team, it's actually benefiting patients from different perspectives. First of all, it ensures that patients receive comprehensive cancer care. That is, their care is addressing all aspects and needs of their health, including physical, emotional, and social needs. Further on, using the multidisciplinary teamwork allows for more efficient and more effective decision making regarding the treatment options. The MDT can discuss each patient's case and, of course, through shared decision making, determine the best course of action based on the unique needs of the person affected by cancer and the unique setup of uh, his or her circumstances. But of course, as there are so many benefits, there are also challenges of the multidisciplinary teamwork. And one of the challenges is communication among team members. Each member may have a different perspective and expertise, and that can lead to misunderstandings and disagreements sometimes. So, altogether with the challenge of communication, there is another possible challenge in coordinating so many different schedules and ensuring that everyone involved in the patient's care is able to attend the MDT meetings and to participate in the discussions. Some great examples of using the MTD approach are, you know, the tumor board and the patient navigator. Because fortunately, the multidisciplinary teamwork is becoming increasingly common in cancer care. So, for example, as mentioned, the tumor board can bring together experts with different professional perspectives to discuss the individual cases and to develop treatment plans and also sometimes survivorship plans. Navigators, patient navigators who can be also nurses or social workers, they work with patients and their families to coordinate the care and to ensure that all members of the multidisciplinary team are on the same page. Research has shown that the multidisciplinary team can lead to improved patient outcomes like better quality of life and also sometimes longer survival rates. Actually, one recent study found that patients who were treated by a multidisciplinary team had a 25% lower risk of dying from cancer than those treated by a single discipline team. So, multidisciplinary team is essential for providing comprehensive and effective cancer care. Of course, while it presents some challenges like communication and coordination difficulties, it's most certain that the benefits are outweighing the difficulties involved for the sake of the people affected by cancer. But even though we acknowledge and use the power of collaboration, we must talk about the cancer divide or inequalities in cancer care. Because it starts with disparities in screening. I think one of the biggest inequalities in cancer care is the disparity in screening rates between different populations. Studies have shown that low income, uninsured, or poorly insured, and generally speaking, minority groups are less likely to receive recommended cancer screenings, which indeed are leading to later diagnosis and poorer outcomes. Another very specific area of inequalities in cancer care exists in the phase of the cancer diagnosis. Some patients may face longer waiting times for the diagnostic tests of confirmation or experience delays in receiving their test results due to factors such as geographic location, insurance status, or many times language barriers. Treatment disparities are existing even after a cancer diagnosis, and some patients may face this type of inequality in their treatment. For example, studies have shown that minority patients are less likely to receive surgery or radiation therapy and more likely to receive suboptimal chemotherapy regimes than their white counterparts. Finally, inequalities in cancer care can also manifest in differences in treatment outcomes. Some studies have shown that African American women with breast cancer have higher mortality rates than white women, even after controlling for socioeconomic status and other factors. So it's critical that by identifying and addressing these disparities, we can work towards a more equitable healthcare system that provides the best possible outcomes for all cancer patients. And yes, we certainly need to be working and breaking barriers and make cancer care more equitable and more inclusive. So, as we just heard, studies have shown that certain populations, such as racial and ethnic minorities, low income individuals, and those living in rural or isolated areas, are more likely to experience disparities in cancer care. And also, we acknowledge that these disparities can manifest in various ways, such as delayed diagnosis, limited access to treatment options, and a lower quality of cancer care. So, ensuring equity and inclusiveness in cancer care, it's not only a moral option, but also a practical one. Providing equal access to care and addressing disparities can improve patient outcomes and also reduce healthcare costs that are involved in their care. So, further on the psychosocial part, promoting equality, equity, equality, and inclusiveness can help also in building the trust between patients and healthcare providers, which indeed is leading to better communication and better collaboration in the cancer journey. There are several strategies that can be used to achieve equity and inclusiveness in cancer care. These include increasing access to screening and treatment options, providing culturally competent care, and addressing the social determinants of health. Also, very important, involving patients and their families in the shared decision making process and promoting a patient centered care can help ensure that individual needs and preferences are taken into account in a cancer care. So it's very important to also take a look at the new data, which shed light on the extent of disparities in cancer care and the impact they have on the patient outcomes. As just mentioned, a study found that black women with breast cancer are more likely to experience delays in diagnosis and treatment than white women. Another study showed that individuals living in rural areas are less likely to receive recommended cancer screenings than those living in urban areas. So, these just two findings are underscoring the need for continued efforts to promote equity and inclusiveness in cancer care. Equity and inclusiveness in cancer care are essential for ensuring that all patients have access to quality care and to achieve optimal outcomes throughout their cancer journey. I would like to thank you so very much for your kind attention. Now it's the moment to say goodbye. So, if you would like to stay in touch, please use my email address. For now, wishing you all the best from Cluj.